There are some questions about different patients saying that what's a needle RF, because I already talked about the RF saying that it's used for the lifting. Can we also use the needle RF for the lifting? But I have to say that they have a very different effect. Needle RF is kind of different, meaning that needle RF is putting the needle inside the skin. So when the needle goes in, we can change the depth of the needle, so we can pinpoint the parts that we want to have the effect. And lastly, it can use for the redness of the face because it can decrease the vessels that's raised up from the inflammation. What we do in my clinic is a little bit different from other clinics, is that we put the very good solutions, Laquan solutions, before the needle RF. We also use the needle RF such as a micro needling. The reason I do that is that when the ingredients are going inside, it will increase the regeneration rate from the RF. It's one thing very different from other clinics that we do, is to decrease the complication that patient might have and increase the effect. And also what the needle RF we use is called Surfirm. And the reason why we use that, it's the original RF Yes, actually, in my opinion, if I have to choose only one, needle RF will be the best. Because if the scar is very deep, we can go inside a little bit deeper. And if the scar is very shallow, we can also use the tip to be a little bit shallower, so we can change the point of the depth of the places that we want to have the effect. And also we can push the ingredients that we want to get inside the skin. Other lasers cannot do that. So that's why if I have to choose one for the acne scar and to make the skin smoother, like very silky, then definitely Surfirm needle RF will be the best solution. Normally in my clinic, I would combine them together to make the needle RF go inside a little bit deeper. And then first I'll do the pico MLA first, because it goes into a very shallow area. And actually if the machine itself is good, you can change the depth also with the pico MLA. So what it does is that when the pico MLA goes inside the skin, the laser, it forms a plasma. And it forms a small vacuole inside the skin, which will also regenerate the skin very well. And after the pico is inside, I also do the needle RF a little bit deeper so that I can have both the superficial and the deep layer. When the needle RF is inside, as I told you, we put the solution before the needle RF. So when the solution goes inside, it'll help to protect the skin, which will decrease the complication. Even though the patient is not good at washing, or maybe they have to go work out, they will probably have to go working, then it'll help the skin to regenerate better.